My name is Robert Jottis. I'm Recruitment Coordinator in Human Resources for Citizens Memorial Hospital. I've been with CMH since 2014. Today we're going to go over just general expectations we have of our students, whether you're preparing for a clinical rotation, an internship, or another student experience. Just general expectations we have for you. So we'll go over general expectations, safety, security, back safety, and then infection prevention. CMH mission, caring for every generation through exceptional services by leading physicians and a compassionate healthcare team. Our vision is to be the first choice for customer-focused healthcare to every generation. CMH Pride, our core values. I am positive, respectful, innovative, dedicated, and empowered. Together we are CMH Pride. Job behavior. These are 10 guidelines that we ask that you comply with. Cooperate fully with all persons with whom you work. Converse in hushed tones when working in patient-resident areas. Show courtesy to all patients, residents, visitors, and fellow workers. Only use authorized entrances and exits. Never leave your assigned work area without permission from your supervisor. Do not indulge in any type of practical joking. Do not accept tips from patients or visitors. CMH does not provide facilities for students' mail, so please have your mail sent to you on residence. Do not receive personal visitors during working hours, and keep out of other departments unless specifically assigned to those. Confidential information. Each of our patients, residents, entrusts him or herself to the care of all individuals with complete confidence that all information about him or her is held in strict confidence. There may be legal liability for you and the organization in the unauthorized release of medical information. Remember, do not gossip about a patient, resident, personnel, or medical condition, coworkers, other patients, residents, visitors, or anyone else. If anyone outside the organization asks about the affairs of a patient, report the incident back to your supervisor. Medical records are confidential. Information contained in there cannot be released without written consent. Any person who violates the sacred trust or confidence may be terminated from the work experience immediately. Elder abuse. Policy states CMH staff will follow regulations and standards in the identification of and procedures for handling alleged victims of abuse. Refer to Policy SS-0509, Abuse Dependencies, for additional information relating to identification of types of abuse, resources, guidelines, and training. Mandatory reporter. In the event a physician, nurse practitioner, physician's assistant, podiatrist, psychologist, social worker, pharmacist, physical therapist, hospital, facility, or clinic personnel engage in examination, care of treatment, long-term care facility administrator or employee, and home services provider, or other health practitioner, or other person with responsibility for the care of a person 60 years of age or older with disabilities ages 18 to 59 has reasonable cause to suspect that an individual has been subjected to abuse or neglect, or observes this individual being subjected to conditions or circumstances which would reasonably result in abuse or neglect, should immediately make a report to the Department of Health and Senior Services. So that number is 1-800-392-0210. Child abuse. Policy states CMH staff will follow regulations and standards in the identification of and procedures for handling alleged victims of abuse. Again, refer to Policy SS-0509, Abuse Dependencies, for additional information relating to identification of types of abuse, resources, guidelines, and trainings. The same mandatory reporters apply. Physician, nurse, dentist, podiatrist, psychologist, mental health professional, social worker, hospital, facility, or clinic personnel that are engaged in the examination, care of treatment, or other health practitioner, or other persons with responsibility for the care of children has reasonable cause to suspect that a child under 18 years of age has been or may be subjected to abuse, neglect, or observes a child being subjected to conditions or circumstances which would reasonably result in abuse and neglect should immediately report to the Children's Division. So the hotline is the Missouri Child Abuse and Neglect Hotline, and that number is 1-800-392-3738. Domestic abuse. Policy states refer to SS-0509, Abuse Dependencies, for additional information relating to identification of types of abuse, resources, guidelines, and training. Procedure states domestic abuse or violence is defined as a pattern of controlling, assaultive, or coercive behavior that adults and adolescents use against family members and partners. Personnel, including physicians, nurses, therapists, or other medical professionals, shall report the following circumstances involving suspected domestic abuse or violence to local law enforcement. If the patient dies or is in imminent danger of death, or for treatment of a person for a wound inflicted by gunshot, including the nature of the wound and its circumstances. Drug-free workplace. Policy states the use, possession, distribution, or sale of drugs by organizational employees while on organizational premises or while engaged in organizational business is prohibited. Reporting to work while under the influence of alcohol, drugs, and/or controlled substance by an employee/student is prohibited. Those who violate these rules will be subject to appropriate disciplinary action, up to including discharge. This policy applies to employees, including full-time, part-time, as needed, or contract, volunteers, and students. Sexual harassment. It's the policy of the organization that sexual harassment is a prohibited personnel practice and it results in discrimination for or against an employee on the basis of conduct not related to work performance. It's defined as a form of employee misconduct which undermines the integrity of the employment relationship. Sexual harassment does not refer to occasional compliments. It refers to behavior that is not welcome and/or personally offensive and/or debilitates morale and thus interferes with the work effectiveness of its victims and their coworkers. If this were to occur, there is a reporting procedure. Step 1 is to confront the harasser. Clearly state that the behavior offends you and you want it to stop. The second step is to contact your supervisor and/or the third step, contact the Director of Human Resources, Jeremy McLaughlin, at 417-328-6628. Smoking and tobacco regulations. Policy states the organization will comply with regulatory standards and local municipal code regarding smoking regulations. And because smoking has been acknowledged to be a fire and health hazard, a continuous effort shall be made to eliminate tobacco and smoking in organizational facilities. Smoking or use of tobacco products, including pipes, cigars, cigarettes, electronic cigarettes, chewing tobacco, snuff, etc., is prohibited in facilities or on grounds under control of CMH. Dress code. You will be assigned a student badge. This should be worn in the chest area. Inappropriate dress. Clothing that is torn or frayed, tight or revealing, shorts are not acceptable. Types of denim, including jeans, jean dresses, denim pants, denim skirts, etc. No hats or caps. Heels more than 2 inches. Open-toed shoes in clinical areas with employees providing direct patient care. Jewelry that poses a safety problem. Extremes in fashion. Tattoos, brands, body piercing, gauging, and other body art shall not be visible while at work.
Hi, my name's Sid. I'm a public safety officer for CMH. I've been roughly 8 years. We're going to go through some slides and we'll take a little bit of your time. Hope you guys have a good day. CMH, Public Safety and Security. Safety and Security, my director is Michael Sly. You can reach him at 328-6450. Director of Safety and Work Health is Jesse Shepard. You can reach him at 328-6264. Security, my job in general, report any suspicious activities, thefts, assaults, or anything of concern. You can do this by calling PBX at just dialing 0 on your phone. You can call the security office at 328-6450 or call our security cell phone at 327-5533. We're here 24 hours a day, 7 days a week. We patrol all of our properties in Bolivar. We walk them, we drive them. Security provides escorts to and from parking lots if needed, vehicle jump starts, and will air up flat tires for anyone. We have numerous panic buttons throughout all of our facilities. There are panic buttons located through the organization. If your facility or department have a panic button, your supervisor will show you the location of the panic and how to use it. Depending where you work, panic devices alert security or 911 for quick response. Lock up your valuables and your vehicle. Theft does not occur often, but it is always best to secure your property. Again, please report any suspicious activity or theft, no matter how little. Together we can make a safer work environment. On the safety side, it is important you know the locations of the closest fire extinguishers and fire pull stations and exits. Security conducts drills every month. Depending where you work, you will participate. In fire drills, tornado drills, missing infant drills, manpower code, and code alert drills. All employees will complete an annual training on how to properly use a fire extinguisher. Never remove a fire extinguisher unless an emergency situation or you have asked permission to remove the fire extinguisher from the security manager. Fire extinguishers, this is going to be an anagram. Pass is pull, aim, squeeze, and sweep. Pull the pin, aim the nozzle, squeeze the handle, and sweep side to side at the base of the fire. RACE is an anagram that we have. It's rescue, alarm, contain, and evacuate. Rescue anyone in danger, pull the fire alarm. If you can, contain the fire. If not, then evacuate everyone out of the building. It is important you review the emergency response plan on the intranet and what role is in the event of an emergency situation. You may access this by getting on the policy stack. There are evacuation routes posted on the walls in all the buildings. Please become familiar with these. If you do not know your department's emergency role, speak with your supervisor or security. Emergency access. Emergency access and egress are critical during emergency situations, such as a fire. During a fire, timely and quick response are essential to save lives and property. Obstructed emergency egress ensures that building occupants can exit a building to safety. Never block any exits or fire extinguishers, or in the hospital, the oxygen shutoff supplies. Do not block the following: fire extinguishers, exits, oxygen shutoff valves, hallways with beds or wheelchairs, and breaker boxes. Never store anything 18 inches from the ceiling. Nothing may be stored within 18 inches of the ceiling where a fire sprinkler is. There's a life safety violation and also prevents a sprinkler from covering the area and functioning properly.
Back safety. Click on the link to watch the back safety video.
Hi, I'm Joylyn Smith. I'm the Infection Prevention Coordinator. I joined CMH in 2018, and today I'm going to be talking about basics of infection prevention. What is infection prevention? The goal of the infection prevention program is to identify and reduce risks of infections in patients, residents, employees, and visitors. Why is infection prevention so important? Infection prevention practices are important in maintaining a safe environment for everyone by reducing the risk of the potential spread of disease. What causes infections? Infections are caused by microorganisms or germs, which include bacteria, virus, parasites, and fungi, which all cause different types of infections. People, water, and food all serve as reservoirs for microorganisms. All elements in the chain of infection must align in order for an infection to occur. How are microorganisms spread? Direct or indirect contact, droplets, and airborne particles. Hand hygiene. Hand hygiene is the single most effective way to reduce the risk of infection. The term hand hygiene includes washing hands with soap and water or using an alcohol-based hand rub. Indications for hand hygiene. The 5 moments for hand hygiene from the World Health Organization. When entering a patient's room or care area and before touching a patient, before a clean or aseptic procedure, after body fluid exposure risk, after touching a patient or surroundings, after glove removal, and when exiting the patient's room or care area. What can you do to help with infection prevention? Perform hand hygiene. In addition to the previously listed times, perform hand hygiene before starting your shift, after handling contaminated equipment and supplies, before and after eating, after using the restroom, after coughing or sneezing. Practice good hand hygiene and respiratory etiquette. Keep nails trimmed. Bathe daily. Keep hair contained and cleaned. Turn your head away from others to cough or sneeze. Cover your mouth and nose with a tissue when you cough or sneeze. If you don't have a tissue, cough or sneeze into your upper sleeve, not your hands. Report all signs and symptoms of illness. fever greater than 101 degrees, skin rashes or lesions, boils or pustules, productive cough, eye redness or discharge, diarrhea or vomiting, or sore throat. Protect yourself by performing hand hygiene, following standard precautions. Standard precautions means we treat the blood and body fluids of all patients or residents as if it is infectious. Using personal protective equipment, or PPE, as directed and when needed. Do not wear PPE outside the patient's room or care area. Do not eat or drink in patient care areas. Keep your workplace clean and clutter-free. And disinfect contaminated items. Remember to follow policies and procedures. When in doubt, ask your supervisor. Indications for and limitations of glove use. Gloves are not a substitute for hand hygiene. Remember to perform hand hygiene before putting on and after removing gloves. Wear gloves when there is potential for contact with blood or body fluids. Failure to remove gloves after caring for a patient may lead to transmission of microorganisms from one patient to another. Indications for hand hygiene should be followed when wearing gloves. Remove gloves, perform hand hygiene, and don a new pair of gloves if needed prior to proceeding with patient care. Thanks, and have a nice day.
Thank you for choosing CMH for your student experience. If you have any questions or concerns while you're here, please contact Human Resources at 417-328-6426. Again, thank you.